Do you or any of the singers that you're working with have a tongue tie? And how can we even tell? Well, we're here for you at the Singing Teachers Talk podcast, as this week we are joined by certified specialist of orofacial myology, Jessica Luffey. Jessica helps us to understand what tongue ties actually are, and she takes us through a self assessment that we can go through on ourselves, but which she encourages us to present to our students as well. So, what are some of the potential symptoms that singers might experience having tongue tie, and how do they get in the way of our voices? Well, Jessica Luffey, welcome to the podcast. Jessica Luffey, we are so glad to have you on the Singing Teachers Talk podcast. We are going in on the topic of tongue ties today. Your work is really interesting. So we're all off on the same foot. Can you tell us what is a tongue tie and the different types that there are?
Sure. This is a little bit of an in-depth description. So, most people, when they think of tongue ties, they think of something very simple like, oh, a lisp. If you have a lisp, you have a tongue tie. People, when they think of what it looks like visually, they think of seeing a string under someone's tongue that is usually tied to their front teeth. And all of these things are tongue ties. But tongue tie is much more than just that. And in the past 5 to 10 years, what's come about in the medical world is that tongue ties can have many different classifications. They can look very different in all different kinds of people. And there's also a lot of variance in the kinds of symptoms that can show up with the tongue tie, depending on what yours looks like. So, I guess to answer your question, the most important thing to think about tongue ties is that it's not just what they look like, and it's not just a lisp. It's a lot more complicated than that. In regards to singing, tongue ties mostly just affect the tongue's ability to move and to move in an isolated way. So that's pretty obvious that that's going to have a lot of negative impacts on singers if they can't move their tongues.
What actually causes a tongue tie to happen? And does it only happen from birth, or can they come up later on in life as well?
No, they can't show up later in life. They are genetic. You're either born with one or you're not. You can definitely look at your biological parents and see if maybe there's some similarities there because that definitely shows up. It happens in utero, basically when the tongue and the bottom teeth are growing and physically separating for the first time. What we suspect happens is that they're just not able to separate fully, and so you're left with this residual tissue tendon. It's sort of like if you have webbed fingers, they just don't separate all the way while you're growing. But it is a lot more common than people would think. Just giving a rough estimate here, it's very similar to wearing contact lenses. That's about the number you're looking for. So, somewhere between 40 to maybe even 50% of the population, quite high.
Wow, yeah. So what does it look like if we were, what are the variations of appearance that we might be checking out on when I go and see my parents when I ask them to lift their tongues?
Yeah, yeah. So let's start with the obvious one that I mentioned, which is like having that visual string. That is what we in the medical community called a grade 4. So we grade them 0 to 4, 0 meaning you don't have one, 4 meaning it's really, really restrictive, usually very visible. So if you're looking at a class 4, they usually do have some speech problems. They usually sleep very poorly. You can see some sort of white line or rope under the tongue in these kinds of people. And then for everything class 3, 2, and 1, the only way to really tell is to give yourself a mobility test, just like we do in the rest of PT world for the rest of our bodies, because it's not really about what it looks like, it's about how it moves and if you can move. So we can go through a couple of tests that people can do on their own to have a little like self evaluation to see if maybe they could be tongue tied. And then you can go from there and decide, okay, I have some other symptoms that sound kind of familiar. And I also failed the self test. So that would be a really great place to start.
Okay, awesome. Yeah, if we could go through a little self-assessment, let's see who comes out as tongue-tied.
Sure. So I recommend that most people do this in front of a mirror because it's a little helpful. The first thing we're going to do is we're going to take a baseline. So I have everybody with their teeth closed naturally, smile as big as they can, and then open their jaw as big as they can. And all we're doing is just seeing how far you can open your mouth because some people can open quite far, some people not so much. So it's just your personal baseline. And then I like to use a very simple ruler, which is just fingers. How many fingers can you fit sideways in your mouth? So for me, I can get about 3.
And is this with jaw overextension? Like, are we wanting for the jaw to be just falling open without any of that popping out at the sides?
Great question. Let's say as big as you comfortably can. We don't need to force it open, no pain or anything like that. But yeah, as big as you comfortably can.
Okay.
So most people will get 2 to 3 fingers, depending on your how big your fingers are and how open you how open
This
you.
is just going to be cause for a meme or something of just
Oh,
like opening my mouth as wide as I can and shoving my fist in.
yes, exactly. There's no way to do this without a little bit of a giggle. So
Yeah. Okay, so I'm going in.
yeah, go for it. Good. So you're maybe like 2.5. You can squeeze
Oh,
3. Yeah.
yeah.
Nice.
Okay.
Okay, great. Yeah, you can use half fingers too. This is not a formal measurement. Good. Okay, so we have our baseline somewhere around 2 to 3. So now we're going to start actually grading the tongue. So I'm going to touch the tip of my tongue right behind my top 2 center teeth. And I'm going to imagine that I'm gluing it there and keeping my tip glued. I'm going to slowly open my teeth again as far as I can. And then we're going to do the same thing, holding my hand sideways. I'm going to see how many fingers I can fit in. I still get 3. Most people, yeah, you still got 2.5. So that means you pass because ideally we want the same measurement every time because we're going to grade, is the tongue able to isolate away from the jaw? So most people usually pass this test pretty okay. What we're grading in this moment is the tongue tip's ability, right? Because we're lifting the tongue away from the jaw. So is your tongue tip able to isolate? And we're also starting to address the middle portion of the tongue because that also has to lift slightly in order to create that position. So if you did not get the same number of fingers, if you already failed this portion, we don't really need to move on because that means that you already have some kind of restriction. So we'll come back in a moment and talk about what that means. But you're probably looking at a grade 3 or 4 tongue tie just right off the bat with that. And we'll talk about symptoms for that in a moment. But let's continue on for everyone who is still participating. So we did the tongue tip and we did the middle of the tongue, but now we're going to do the back of the tongue, which is my favorite portion because it's the most important to singers because all of our vowels are made back there. That back portion of our tongue actually hooks right into our soft palate muscle as well. So it's arguably the most important part. So we're going to lift the back of the tongue up while we bring the jaw down to see if we can isolate. So this one's a little trickier. I'm going to have everyone just make some tongue click noises. Lovely. And as you keep doing that while I talk, I want you to notice that in order to make that position, you have to suction your whole tongue like a pancake onto the roof of your mouth, which is what we want. Yeah. So we're lifting the whole portion up and then just sort of relaxing it or snapping it down to make a noise. Great. So now what we're going to do is we're going to suction it and hold it up right like we're going to make it click, but we're not actually going to release it. We're just going to hold it there. And you have this lovely pancake, or as some people may know, a cave suction position. And what's really cool about this is when you can really potentially see that frenulum because I'm sucking the rest of the tongue away and it makes it really clear that little dividing line right there. Great. Now, as we're holding this, again, we're going to use our fingers, see how many we get in. I'm about 2.5, 2 3/4. You're squeezing 2.
That's tricky. That's tricky.
Yeah. So we don't need a perfect answer. As you can see, I get 3 on all of mine, but then my last one, and I'm about 2.5. I already had my tongue tie release, so I know that I don't have a tongue tie. I'm still not perfectly mathematically correct, and that's okay. But if you go from 3 fingers to 1 finger, that's usually a pretty big sign. Also, if it's just difficult for you to get into this tongue click position in general, that's a really good sign that maybe you're not spending any time up there. Yeah. So, all three of those together, nice baseline with the tongue down and then tongue tip up, and then your tongue click suction. All of those together is going to tell you if you have a restriction and like you can ballpark what kind of grade your restriction is. And then from there, if you feel like, okay, this is something I would like to explore more, you can go see an airway dentist or another tongue tie specialist. And they have these really fancy little rulers where they'll actually measure you in millimeters exactly how mathematically correct you are. Pretty cool.
Great. And so is that the most effective medical person to go and see, a dentist?
In my experience, yes. There's lots of surgeons who do tongue tie release procedures, like ENTs, for example. But the tongue tie world has changed so much in the past 5 years or so that how people perform the procedure is very different than they thought it was 20 years ago. And unfortunately, when people go to their like higher education to become a surgeon, they just kind of talk about tongue ties like we did at the beginning. Oh, it's a lisp. I'm just going to cut the little string and that's it. And that's not really what we're doing these days. That's not really like the height of good care anymore. And so it's really crucial that people really do their own research and also have a specialist to assist them when they're going through this process because you can't necessarily trust that just because they say they know how to do the procedure that they know how to do it in the new correct healthy way.
Everyone who has a lisp, do they always have a tongue tie?
No, not necessarily, but about 90% of them do. You can have a list just from having lack of muscle tone, but that's pretty rare.
What is the procedure that you would be encouraging singers to be having if they do have a tongue tie and need that released?
Oh, yeah. Let's talk about we'll call them the good route and the bad route, right? So the bad route is you find someone who says, "Oh yeah, I can do that. Come on in today and I'll just sit you down in the chair and we'll just whoosh, take it out right now." If anyone ever says that to you, run screaming the other direction. You want someone on the good route who's going to say, "Oh, I see that you have a tongue tie. You need to go through myofunctional therapy prior to your surgery so that we can strengthen you up. And then I'm going to perform what we call an active release, meaning that the patient participates in various tongue positions while you're actually having your surgery done. Don't worry, you're still totally numb. You won't feel it, but you are participating. And then you have to do some myofunctional therapy afterwards as well, because you're going to be a little bit wiggly in your brand new tongue that has so much mobility. And so we need to give you new healthy habits and make sure that you heal in a healthy way. So it is a lengthier process, but it pretty much guarantees that you're going to have a fabulous result. And it also guarantees that you won't have to go back for another release because they didn't quite get enough the first time.
With regards to the exercises that you just took us through in terms of trying to do a self assessment whether we might have a tongue tie, I'm not a tongue tie expert like you, and many listeners might not be as well. So, if we're noticing that we're might be working on some tongue things, or there could potentially be a tongue tie, is that something that we can get our singers to do, or does that really need to be just not touched by us and sent over to somebody like yourself to do that?
Oh, I would beg people to please open that conversation with your students because most of the time they might secretly be harboring a lot of harsh feelings about how their body already feels. Tongue ties can cause a lot of pain, a lot of tension, and most often it prohibits people from progressing in their technique because it's physically limiting them. And unfortunately, if these people are good students and they do practice a lot, what can happen when you don't progress is that all of these feelings, these emotions turn inwards, and people start to have a lot of self confidence issues. They tend to feel really poorly about themselves. And as Einstein said, right, you go a little insane from doing the same thing and not getting any changes. So, if you suspect if any of those things sound familiar, like if you have a student who progresses in every single way except one or two, I would say that's a really good red flag. If you have a student who practices diligently and yet doesn't seem to make a lot of headway, that's another really great red flag. And opening this conversation with your students, mostly because they trust you more than a random doctor you're going to send them to. And so it creates a nice open space where you can kind of explore it together and just see if, oh, let's take this tongue tie test together. Something really easy you can do in your studio. You don't need any equipment, just a hand, right? So we can take that together and say, oh, you know what? I think your tongue mobility might be affecting your technique, or it might be causing some of your tongue tension pain. Would you be willing to go see a dentist and have them look at you and see what they say? Something that can sort of open the door and allow them to explore. And usually, what happens is once we sort of bring it to their attention, people go and do their own research anyway. And when they're doing their own research, their own exploration, that's usually when most people will say, oh, wow, I really empathize with what so and so said about their jaw tension. That's me. I see myself in them. Oh, I really empathize with what this person said about never being able to be in pitch in my upper passaggio. That is something that happens to me all the time. And then they start putting their own identity into it too. And that really helps people feel even more safe.
With regards to the grades, you said there were grades 4, 3, 2, 1. At 4, is that you really would benefit from going to have the release work done? And what does it mean for like 2 and 3s and maybe the occasional 1 in there?
Singers are a little more than a little different than humans, especially in tongues, because it's like runners talking about their feet. It's incredibly important for us. So I'm going to slightly amend what I said. In the medical community, we talk about grades 1 through 4. When we're talking about singers, I like to talk about not necessarily grade 1 through 4, but where your tongue tie inserts has the biggest effect on what singing symptoms you could be having. So, for example, I've seen some clients who are a grade 1 or 2, so they're pretty mild, and their tension or their restriction only shows up when they do the posterior test. Now, they've even been to some airway dentists who say, you passed the test, you look pretty good. I don't really think you need it. And then they come to me and they say, yeah, but I can't sing closed vowels on high notes. My pelvic floor is really slow. I can never get into my upper range without really driving my breath. So there are some, what I like to call singing symptoms that are associated with different aspects of tongue tie. So when we talk about the tip of the tongue, people who have tip restrictions usually have articulation issues. They really dislike patter arias. That's really hard for them. They tend to have a lot of face tension, lip tension, maybe even some jaw pain when they sing. And they also are people who most often express a lot of dull achiness right under the chin, where we talk about tongue ties. Um, there's more, but that's sort of the heavy hitters. When we talk about middle tongue restrictions in singers, these are usually the people that have a lot of anterior front of the neck pain. They also have a lot of slow rib support in their breath support. They often say things like, I can't breathe out all the way, or I can't breathe in all the way. They don't have any problems with vocal endurance usually, but they really have trouble controlling their breath, even if they may cognitively understand it very well. These people also have a lot of trouble in their upper and lower passaggio, staying in what we call like a forward placement or keeping everything in a nice even line. They can sometimes have like some shoulder tension as well. Those are sort of the big ones for middle ties. And then posterior ties, these are the people that really, they'll say things like, I know I can sing higher, but not without pain. Or I can hum up to a D6, but I can only sing an A5, things like that. Or they'll say, I can sing the most beautiful high note on an ah vowel, but I can't do it on an E vowel. So this has nothing to do with technique. Singing on a pure E that high is going to sound ugly, but we should be able to do it without pain and tension. These people can't. They also usually have a lot of posterior or back of the neck tension and pain. They'll even occasionally have migraines right where their spine attaches to the bottom of their skull. And they often experience a lot of trouble with their pelvic floor, both it being overly tight, usually in women, or also a little bit too relaxed. When they go to engage their pelvic floor for high notes, it can feel like nothing happens, or it happens too late, or it does squeeze, but then just kind of dissipates. So, those are sort of like the main ones when it comes to those three aspects. But when we're talking about tongue ties, I want to stress the fact that because the tongue attaches to the floor of the mouth, the tongue tie starts in the back and then moves its way to the middle and then may move its way to the tip too. So it's really important to understand that if you have a tip restriction, you definitely have a middle and a posterior as well. If you have a middle restriction, you definitely have a posterior as well because it has to go through that area to get to the middle. So if you say, oh, well, like the middle ones really affect me, but I don't have the posterior ones, you may not have the posterior symptoms because they're being masked by your middle tongue symptoms, but you are still restricted in that mobility in that area.
Some of the reasons why we would experience some vocal difficulty because of a tongue tie might be self-explanatory, like the patter songs, the mobility that it might affect. But why might it give you shoulder pain and migraines and those sorts of things?
Yeah. So the tongue tie, that tissue is sort of like a bonus malignant tightness that is incorporated into what we call the fascia system in the body. And if you don't know anything about fascia, go Google it because it's going to be a fascinating rabbit hole of discovery. But basically, what fascia is, if you're preparing raw chicken, it's that weird, like white tendony thing that you have to peel off of it. Fascia is a tissue system that sits in big sheets that run the whole way through your body, and it goes between different muscle groups, and it basically allows the muscles to slide against each other without getting stuck. So the tongue tie can be incorporated into the deep frontal line of the fascia system. And I really recommend that everybody go Google what the deep frontal line looks like, because you'll see that it goes through all of these super important structures in the singer's body. It goes through your tongue. And then what does it go through next? The front of your neck and your larynx area. Then what does it hit next? Your diaphragm. Then where does it go next? Your pelvic floor. Then where does it go? Your hamstrings, which adjusts like how you stand with your knees and if you're able to push against the floor to create good breath support. So not only is the tongue tie affecting the mobility in your tongue, but it's actually affecting your entire performance as a singing athlete because it's going through all of the major structures that we singers need to use in a specialized way.
Yeah, it's so incredibly mind-blowing. We had Jenny Morton on the podcast quite a few times. We love her, and she's done a webinar for us as well over at BAS talking about the sausage strings of fascia and how if something's tugging at one end, you can bet your bottom dollar that it's tugging somewhere higher up in that fascial train. She talks about, working on people's feet as a way into maybe sorting out something higher up. So, would any level of vocal technique, exercise in, tongue drills and jaw stop tongue drills and rolling shoulders and breath work, would that just be exercise rather than progression if you have a tongue tie?
When we work on the fascial system, I love myokinematic release. I think it's really fantastic and every singer should have it done. But this tongue tie is not or should not be naturally present in that system. So you may be able to get some relief by manipulating the system in order to create like a temporary relaxation in the tongue. Maybe if you have a grade 1 or 2, but if you have a 3 or 4, it's not going to do anything for you. And after a week, as soon as you walk out that door, or as soon as I put your body in a different position that requires a higher demand, it's going to stop you again. So, this is definitely something that needs to be addressed at the source from surgery. I like to talk about what's the cart and what's the horse analogy. We can really make that cart as beautiful as possible and do lots of body work and give ourselves great singing positions and vocalises. But at the end of the day, you need to perform in a healthy way. You need to be able to have the endurance to do so. And you certainly need to have the confidence that you're going to be able to do those tasks. And that all comes from addressing the tongue tie.
So our listeners who did the assessment can see where they might go next. Like for me, I could do 2 and a bit fingers and then maybe just 2 later on in the exercises. What would that mean if you're kind of just matching them, but maybe some things are just a little out?
Yeah, I would say the best thing to do at this point is to say, okay, if I'm on the fence about being classified as a human of having a tongue tie, then let's explore if any of these singer symptoms are pertinent to me. And if they are, then we should definitely go talk to a specialist who's familiar with singers so we can really see, is it a technique thing or is it a tongue tie thing? But honestly, you can probably answer that yourself. So we'll take you, for example. Do you ever feel like you have trouble singing closed vowels on high notes?
No,
Okay, so that's good. So you didn't have that symptom. Do you get migraines or anything at the back of your head?
I do get, yeah, aches just at the back of my neck. And that's where in manual therapy, they tend to focus on when I go for massage.
Okay, so we're going to flag that. Yeah. And you say that that's a chronic area that you have to address?
Yeah, I've been set exercises to, stretch the back of the neck and that sort of thing.
Right. So, yeah, it's that turn of phrase that we're really looking for. What are chronic things or things that don't seem to get better that fall within that category? So, yeah, you have some neck tension there. Okay, we're going to flag that one. Let's see if we can find some other singing symptoms. Do you feel like your soft palate or your pelvic floor is a little slow, sluggish? It'll lift and then collapse.
Well, I try to do my Kegels exercises. I tend to forget. I don't know if I'm obviously engaging it at some point, but I don't know if I'm really that aware of my pelvic floor.
Ah, okay.
I'm trying to do it now. I'm doing my exercises as we speak.
That's also a Kegel, ready, go.
It's any time anyone says Kegel, I'm like, oh crap. Quickly do 10.
Well, I think the pelvic floor does or engage naturally when we're undergoing breath support. It has to without us having literal accidents, right? But when we're specifically talking about singing, there are specific times when we're going to have to engage that a little bit more forcefully if we need it for the task at hand. Like a high D6 comes to mind. um, yeah, so people who have posterior tongue ties, not all of them, But usually women will say that they have really overly tight pelvic floors, sometimes causing them pain in their daily life. Or they'll say things like, yeah, my teacher tells me to do that, but like, I don't really get it, or like, I don't really understand why it matters, or I don't really feel anything happening down there, or like, I squeeze it and then it lets go and I can't hold on to it. Those are all common things. If you're any of those people, what basically should be happening is that you should be able to squeeze and hold as long as you'd like.
Oh, yeah. Mine definitely wants to let go. It's like, no, release me.
Yeah, you should be able to so you should be able to here's my little jellyfish. You should be able to squeeze quickly and hold it. You should be able to slowly squeeze more and more and more, like a little continuum, and then hold it. You also should be able to squeeze, release, squeeze, release.
Yeah, I can
If
do
you
that one.
if you can't do any of those 3 patterns, then maybe we should flag that.
Yeah.
Yeah. So, just to go back to your main question, yeah, definitely you should be looking in the normal human category for symptoms and also in the singer category for symptoms. It's rare, but like I said, I do meet some people who have no human symptoms and only singer symptoms. They get their tongue tie release and they're like, oh my God, it fixed everything. My teacher noticed a difference. I finally can do all of the things that I understood. If I can Actually, I would say that's the number one thing that teachers and students can talk about with each other.
Mm.
If your student conceptually understands good technique, if they have the knowledge, but they can't do the application, that's a really big red flag.
Okay. You mentioned that you've had your tongue tie released. What were your symptoms vocally?
Yeah. So I actually had mine released twice because the first time I went to someone who was very good, but he wasn't excellent and he wasn't well versed in singers. So he did what I talked about before in the bad route, where he just kind of took what he could see and called it a day. The second time, I went to someone who performed an active release. He would say, oh, how does that feel? I would even do some vocalizing in the chair. And that's when I was really able to get like 100% isolation. But bef- way in the beginning, when I was still virginal tongue, I had class 3 a class 3 modifying to a class 2, which basically just means I was cheating and looking like a class 2, but I was really a 3. I had a lot of pitch troubles with my tongue tie, which is a fascinating side note, but pitch can be caused by tongue ties. I had a great ear, but I couldn't sing in tune, especially in my upper passaggio. I had tons of vocal endurance problems. I had lots of pelvic floor trouble and I had lots of soft palate trouble. And it masked itself for a long time because I would say things like, oh, well, I just have a really metallic sound. I just can't float like some people. That's just my fuck, and that's just who I am. But knew that eventually I would have to sing something piano at some point in my life. And I couldn't do it, and I couldn't figure out how. And I was an opera singer and had trouble with my soft palate. So I didn't find out about this till I was studying myo myself. And when I got my first tongue tie release, I did get a lot of really great changes. Um, so I thought everything was all good. I was in my new life. Hooray. And a few years went by, and that was right when I was starting to also teach singers about tongue ties. And I started noticing that a lot of the symptoms that they came to me with, I still had. And I thought, oh, that's a little suspicious. So I kind of watched it for a little while. And then I decided, yeah, it's still there. I need to go to someone really excellent. During that time, I had made great colleagues with a gentleman in New York who I now send all my professionals to. He's the best in the whole world. He's incredible. I went to him, and that was when I was like, okay, I finally don't have any of these symptoms. I don't have human symptoms. I don't have singer symptoms. And I even felt in the chair all of those changes that I was looking for. That's very common, not universal, but yeah. So I had my second release done and couldn't be happier. That was about 4 years ago now.
Wow. And who's the guy that you send people to?
Yes, his name is Dr. Montrose, Montrose. He is incredible. I cannot recommend him enough. Please go check him out. He also, at the moment, is one of the cheapest in the business. Always great to have cheap and best. We love that.
I don't know if there's any research on this yet, but how tied, sorry, pardon the pun, how tied are tongue ties and vocal injury?
Mm. I was just editing a video before we hopped on
Oh, right.
about one of my clients who had a vocal polyp and also some vocal hemorrhaging. He is currently in university for MT discipline, musical theater, and he had a polyp. And he had his polyp while we were going through his tongue tie release and didn't know. He had his tongue tie release. Lots of things got better, but he said, I'm still not feeling vocally great. I said, okay, well, go get scoped. Let's see what happens. Turns out he had a polyp. It had been there for quite a few months, and we didn't really know. And they said, well, you need surgery. This will not go away on its own. He said, okay, well, if it's not going to go away on its own, then I'm not going to stop singing. I'm not going to go on vocal rest. I'm just going to do my thing if I need surgery. So that's what he did. He had to wait 4 weeks before they got in for the surgery date. So in those 4 weeks, not only was he still healing from his tongue tie release, but he was singing and stuff. He goes back in about 5 days before his polyp surgery and they scope him and it's not there.
Whoa, okay.
It's not there. It had absolutely disappeared, which I still get chills thinking about. And we had a little bit of a grumble because he was like, and these people, they specialize in singers and they didn't even seem like interested in the fact that it just went away. And they said that it wouldn't. And I wasn't even on vocal rest or anything. So, we can't definitively say, oh, it was the tongue tie release and nothing else, but it's one heck of a coincidence. There's also some overlap between muscle tone dysphonia and tongue ties. That one is a little bit more easy for people to see, right? If your muscles can't move in a nice way, they're going to have to make some compensations, and that's going to, in effect, affect your larynx and hopefully not, but can sometimes cause some vocal damage. So I am in the process of researching that. If anyone would like to volunteer, I'm looking for guinea pigs. But it's just a slow process. As people may know, research is slow and expensive, but we're trying to do that. Yeah.
Once you've had your tongue tie released, well, actually, first of all, what's the surgery? What is it?
Yeah, yeah. So people hear surgery and they start to panic. So let's just take a deep breath. It's not that bad. I liken it to kind of like getting a filling done. You're awake the whole time. They just numb you out in that specific area of your tongue. Most people use a specific type of laser. There's many different kinds, so that's something you have to watch out for, which is why you need someone like me to sort of help you find a great surgeon. But they're going to laser release that area. The whole thing takes about less than an hour. You can walk right out, go live your normal new life. You can talk right after. Most people don't want to because it's a little uncomfortable. You'll be in resting pain, meaning if you're just watching TV, you're a little uncomfortable for about 2 days, max of 4. Most people are really only in pain when they're eating or when they're doing their tongue stretches. You can go back to taking voice lessons 5 to 7 days afterwards. You'll be a little wiggly like jello for about 2 to 3 weeks. So I recommend that people don't do any high stress auditions or performances, anything like that, for about 4 to 5 weeks after surgery. At that point, you should be fine. Different myofunctional teachers have different timelines. I tend to be one of the fastest around because I don't like to make people wait. So I like to say, the whole process can be in and out in 10 weeks, 5 weeks of prep, muscular prep. It won't affect your voice lessons or any part of your normal life. Then you go for surgery somewhere around week 5. That first 2 days, especially, but maybe the first week, it'll affect your singing and stuff. And then you have another 5 weeks of muscular rehab afterwards. At the end of those 10 weeks, you still will be doing some deep healing in the tongue area, but you probably won't notice it at this point. So you'll be pretty much set up to go live your glorious new life. And as I say, never see me ever again.
We've had Walt Fritz on the podcast before talking about functional tongue challenges, exercises, what he goes through in the studio. Can you tell us a bit more about the myofunctional work that you do and give us an idea of the exercises that we might expect if we're getting that pre-op and post-op muscular training?
Sure. So I do myofunctional training for people who even don't want to do tongue tie release, and it can be beneficial for everybody. I liken it to like a sports therapist, but for singers. There's specific tongue and even body positions that we have to go through in order to complete our sport in a healthy way. So we'll do various isolation exercises of the tongue. Some of them are voiced, some of them are not. We do a lot of mirror work. I like to say that I'm not really a voice teacher because their primary goal is to create a great sound. My primary goal is to make you move in a healthy way that lasts forever so that you can create whatever sound you want. As people may know, there's 8 different muscles in the tongue, and you can choose whether to use them in isolation or together, depending on what task you need. And even in the different genres of music, sometimes we have to hold our tongue in various different positions. So, yeah, we'll do muscular exercises and vocalises in exaggerated tongue positions on purpose. And then we'll slowly move our way back to more normal singing tongue positions.
Could you show us one that we could maybe do on ourselves?
Sure. So a really great tongue one is, I like to call this fat skinny. So our tongue blade, or meaning the part that's not attached to anything, can change its shape without changing its location. This can be really beneficial in all types of singing because we need the root of the tongue to sort of help the larynx at all times. But the shape of the tongue, we can change to create different overtones, different vowels, different colors. So if you stick your tongue straight out, just like a puppy dog, relax, and then you do a little sit-up motion where you try to make your tongue shape like a cup, sort of like when a dog drinks water. You should feel it exactly along the outside, like a horseshoe shape of your tongue, and you'll notice a little divot in the center. So that's our fat shape. But I can do the same thing, a little sit up, when I really think about the tip of my tongue and lift it, and my tongue stays pointy or skinny.
Oh, that one's tricky.
Yeah, tricky for you, maybe. Some other people may find that their fat is actually a lot trickier. So I'm just doing 2 little different sit ups of my tongue, one in skinny, one in fat. And what's interesting is that my vowels are all made with the root of my tongue. So I can hold those different positions and make the same vowels. Eh, 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 eh. I'm switching back and forth. And if I do it more slowly, I wonder if you can hear a difference just from that. So if I do a fat first, e, e, and then I switch to skinny, e, e. And if I do it on a pitch, we can really hear a difference. So here's fat, e, 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 and I'll switch to skinny, e, e, e. You can hear a big difference even though my tongue is literally sticking out of my mouth and I'm not quite making a clean vowel. But can you hear the difference in the overtones?
Yeah, you can. And I was touching my jaw here, but I could really feel my jaw getting engaged. Is that quite normal?
Yeah, so that's another thing that we work on, when we talk about isolation. Can I move just my tongue and not my jaw? Can I move my soft palate and not my lips? These are all things that, whether you're tongue-tied or not, are very important in the sport of singing.
When we're thinking about some of the exercises we might have in our toolbox as singing teachers, I know a bunch of mine have been tongue stretches or tongue related drills or whatever. And having this conversation, I mean, is there something that we should be considering, mindful of? Are they useful to someone who's got a tongue tie or not?
Tongue stretches and drills are obviously not only useful, but required in singing. But I would say we get in danger because we all just assume that everyone's tongue is the same, that it's the same shape, that it's the same length, that it can do all the same things. And they really can't. And that's honestly just regardless of tongue tie. And then when you add tongue tie to it too, then it can really sort of muddy the pool. So, what I would suggest to people is before you do any sort of really invasive tongue thing, like pulling it or stretching it or extending it, something way beyond like a normal singing position, we should always stop and assess them for a restriction first because they might not physically be able to do that position. Like some people with tongue restrictions can't extend their tongue out of their mouth hardly at all. So if you ask them to do that, and then we add the stress and the force of them vocalizing while doing that or physically holding it, that could potentially cause them a lot of damage. So a good metaphor would be like, let's imagine that you are a track teacher and not a singing teacher, right? You have to make sure that everyone who shows up is wearing tennis shoes. Because I think you'll find that some of your students really have flip-flops on. So before you ask them to run a mile, maybe just take a little look and see what they're working with first.
Are there any particular stretches that you would absolutely put in the bin immediately? Or tongue exercises you would put in the bin?
I'm not a fan of holding the tongue manually with hands. Even when I teach in myofunctional ways with my students, and even after tongue tie releases, we always want the tongue. I mean, the goal in singing is that we want the tongue to do the right thing when we just think about it without watching it and certainly without holding it. I feel like if we have to hold it, it's sort of like using the stick to train the dog instead of the cheese. I like using the cheese. It responds better to the cheese anyway.
As long as it's not gorgonzola, because that is just grim. Last week, we had Sarah El Hout on the podcast. And again, I've butchered her name just like I did in the interview. But we were talking about hypermobility. And one of the questions that she has is with hypermobility being a connective tissue disorder, with things like collagen being impacted, is there a link potentially between hypermobility and tongue ties?
I can't say definitively because there's not any research on that. But in my mind, hypermobility is sort of the opposite of a tongue tie. A tongue tie is all about restriction, it's all about holding things in a position, it's all about limiting mobility. So even though it is part of the fascial system or it can be incorporated into that, its effect is very different. Now, that's not to say that someone who is hypermobile, like me, couldn't have a tongue tie because I did, right? So, if anything, I would guess that people who are hypermobile can maybe hide the tongue tie a little bit more because they naturally have more of a range of motion. But in my experience, getting a tongue tie release creates freedom, it creates mobility, it creates ease and stretch that wasn't there before.
What's the biggest misconception, would you say, about tongue ties and maybe specifically to tongue ties and singing?
I think the biggest misconception is that a lot of teachers and students will say, oh, well, I don't want to get this done because it'll be bad for me. It'll be bad for my voice. It'll change my voice frankly, I just think that's poppycock. I mean, why would improving your body as a human make you a worse singer? That's just silly to me. Also, when it comes to tongue ties, we're just talking about mobility. We're not talking about the shape of your chords and what color your voice is. That's all housed in your larynx. That's what makes you you. We're not changing your color or even like your fach, really. We can potentially, because you're now able to do things you couldn't before, but we're not changing your voice and we're certainly not going to make you a worse singer. All we're doing is that we're giving you freedom and options and control that you do not have now. So, the thing I would just beg people to consider is that this should be the most liberating, freeing thing that ever happened to you physically, mentally. It really is an absolute game changer for people's mental states, even their careers. I've had people go win Met competitions when they did it last year. Sure. Could it all have not been the tongue tie? Yes, they take lessons, they continue to improve, but that's the key. They continue to improve.
Your work is so fascinating. Can you tell us where we can find out more? Are there any resources that you would encourage us to check out? And where can we follow your work and keep in touch with you?
Sure, sure. Yes, I'd love to keep in touch with everybody. The first thing I will say is that I offer free and always will offer free consults to singers because you all are so close to my heart. I know people have a lot of questions about this. Unfortunately, there's not a lot of research or just information for singers out there. I've tried to compile as much as I can in this like big database on my website, basically. So I would check out myo, for singers.com. That's my website for singers. Um, if you're just looking for like providers, surgeons, myofunctional therapists, honestly, the best thing to do is just Google myofunctional therapist near me. I recommend that if you're looking to go through with surgery, you find a really great myofunctional therapist first, because they're going to be the ones who can find you a surgeon, who can hold your hand through the whole process, and you feel like you have a friend and a confidant at your side through that whole process. I would encourage people to just kind of vet people a little bit. You want to look for people who have hosted lectures and events, who have more than one kind of educational training, usually people who hopefully say that they have direct experience with singers. Start there, and then from there, you can just choose based on personality, location. Yeah.
You're doing some research. You've just told us about the stuff that you're getting involved in with tongue ties and potential vocal injury. What questions do you want answered about tongue ties and singing? What's kind of getting you itching for more?
My current obsessions are honestly just tongue ties and pain. I think pain is such a poignant thing in the singing world. And that is what originally got me so interested in my functional therapy before I even knew what it was. Is that I thought it was so curious that everyone on earth who said they had tongue tension didn't open their mouth and stick their tongue out and point at it like this and say, I have tongue tension. Nobody does that. They all lift up their chin and they point under their chin or at their larynx and they say, I have tongue tension and or pain. And yeah, I've just seen so many amazing before and after cases with my clients of their pain disappearing at their surgery, never coming back, doubling their vocal endurance, increasing their pitch by, a whole fifth. I mean, the results, frankly, even to me, who've been doing this for 10 years, it still feels like witchcraft. It's wild. So at this point in the game, any research would be fabulous.
Well, Jessica Luffey, we wish you all the best in gearing this up, getting us the research that we need in the industry. It's been a really interesting chat. Thank you so much.
Thank you so much for having me. It was wonderful to talk to you all. Thank you.